All right. Hello, health heads. Welcome and thank you for checking in to this dose of the Healthcare Uprising. I'm your producer, Jeremy Carr, here with your host, Heather Pierce. So, what is on our agenda for today, Heather?
Well, this is a slightly different conversation as part of the Your Vote, Your Health series, where typically we have people running for different, political positions and whatnot.
All been candidates for office.
Yeah.
So
And
far.
however, we also cover things that are associated with, related to parallel, blah, blah, blah. You use
Policy
the word
and
policy and legislation.
healthcare and policy.
And so that's what this one's about. So we've got Brianna Reinhold. She is a licensed professional counselor. She is the founder of Northern Lights Therapy in Maricopa, Arizona. So another fellow Arizonan. And she started to uncover some real big issues with how that were essentially dictating how she delivers care to her patients, her clients. And with that, she actually has written a bill and she is trying to get it pushed through the proper channels and looking for support from elected officials. And so this is a very policy, or we'll say, election adjacent, because who supports this bill is somebody that you need to use your vote for. And so this is a really important topic around mental health and how we all get access to care and how it is delivered to us and how well that makes us as humans. So anyway, this is a big topic. And everybody needs to listen. I don't care what state you're in, although she's here in Arizona. This affects everybody.
We do have some calls to action in here, especially
Yes,
if you live in Arizona or New York. So if you're in those markets particularly, please stay tuned. And with that, without further ado, here's our conversation with Brianna Reinhold from Northern Lights Therapy.
Hi, and welcome to the Healthcare Uprising podcast. Today, we have with us Brianna Reinhold, who is a licensed professional counselor and also the founder of Northern Lights Therapy here in Arizona. And we're recording this episode as part of our Your Vote, Your Health series, and we'll get into why. Brianna, welcome to the show. We're so glad to have you on today.
Thank you so much for having me. I'm excited.
Yeah, this is going to be a great conversation. So before we get into kind of the meat of the discussion, Brianna, you do a lot of things. Your email signature has like 10 titles. Obviously working in the mental health space. Can you give us a little background of like who you are, what you do, the kind of work that you've done here in Arizona, maybe even beyond the Arizona borders, and then we'll start talking about some of this advocacy and policy work that you are very invested in here.
Yeah, so I was raised by an entire family of law enforcement firefighters. And so I always had that burning question of like, why did people do what they do? My dad was a homicide detective, so it really stuck with me on like why people went that side. I watched how the mental health stigma was there. And so all of my family really didn't get the support. So I wanted to become somebody that people could turn to, felt comfortable. I had my own poor experiences with therapists. So I really wanted to go into the field to be something that was different than your run-of-the-mill therapist. I ended up going to graduate school. I got working in a jail setting, both as a detention officer and then as a clinician. I've worked with juvenile sex offenders, adult sex offenders. I've worked with survivors of trauma. And now I specialize heavily in first responders. I'm a clinical supervisor, so I really want to help the next level of clinicians coming into our field have that quality that schools don't always teach, let you really learn to be yourself. We want more authenticity in those that are coming into the field to really be personable with their clients. So we're trying to shift that change. And then in recent years, I do a lot more guest speaking, training for clinicians with different law enforcement departments, all of that. So I don't like to sit still. I just want to keep kind of pushing boundaries and getting things out there that needed to happen.
Yeah, you've seen a lot.
Yes,
you've been exposed to some pretty bad stuff, huh?
Just
really tough situations. Well, I'm glad you're using your voice because that's the reason you're here. I found you on TikTok. TikTok has given me so many wonderful people. Because you were using continue to use your platform there to talk about some of the issues that you've started to see that impact policy, legislation, and therefore are affecting the way that care is delivered or accessed, or all of those things that we like to talk about here on the Uprising. So can you maybe give us kind of a background on that, and talk a little bit more about some of that work that you're doing in that space?
Yeah. So in December here in Arizona, we had gotten notified of some pretty significant changes that Blue Cross Blue Shield of Arizona was putting into place. It was really going to start to restrict access to care to a lot of people here in Arizona. So we've been able to have our licensed associate clinicians who have completed their masters, have gone through some rigorous training and are under supervision. They've always been able to complete their intakes, their treatment plans, and the diagnosing with us overseeing it as their supervisor. It's definitely heavily watched. We really make sure that they're doing what they need to do, but we look at the quality of care. So we're not just passing clients off from one clinician to one clinician to one clinician before starting. Well, in December, Blue Cross made changes to that, and they pulled that ability, and they wanted the clinical supervisors to take over all of that, which just doesn't align with a lot of us. These people are trained, they're licensed. And again, it was going to decrease that quality of care that our clients got. So a bunch of us that own practices and supervise had met and were like, we need to let the public know what's going on, because insurance companies don't necessarily want to listen to us. They're going to listen to the people that give them the money for their premiums. Well, the fear of retaliation is very real. And so most people did not want to speak up, because we don't want to lose our practices. We don't want to lose the financial, all of that. We don't want to lose what we're doing for our communities. So I ended up making the decision after talking with my parents, because I knew the potential risk that Blue Cross Blue Shield is their money. I definitely can't compete with that level of money. So I talked with my family and I said, this is what I want to do. I want to go public, but I could risk my business. I could risk my home if I'm sued or audited or anything. Who knows what that could be? And my parents absolutely supported me, and they said, we believe in what we're doing. So you do what you need to do, and we'll be here if you need that fallback. So knowing that I had that privilege from my parents and that support, I felt that I needed to speak up, because not everybody has that. So in January, I went on the news here on AZ Family 3, and I shared these changes so the public knew that there was going to be a reduction in availability, what was changing, how it was impacting care. The next day, I got my first contact from Blue Cross that they were going to audit. Well, at first they just reached out. Yeah, they reached out and asked for my fax confirmation literally the day after. I responded, gave it to them. Wow. And then about 2.5 weeks later, I got an email with them again confirming my fax number. And that day I got the fax saying I was officially under an audit. It was stemming back over 3 years, which they're really only supposed to look at 1 year unless they have concerns of fraud, waste, or abuse. I've sent them all of my records. Most of those sessions, clients were seen under like 10 sessions. I don't know how you can tell me that I'm fraudulently billing or wasting resources when the client has had maybe 3 sessions in a 6-month period. I'm still waiting on my audit results, have not heard anything back still, but I ended up going back on the news again in April because it was just too coincidental. Was it retaliation? Mm-hmm. Was it not? They said they started it beforehand, but you can't do much of an audit without my records. So
the next day.
Yeah, the next day.
Come on.
Yep.
Man.
And so they hit me up the next day, but then they didn't send the official request for like 2 weeks. And I go, to me, that's enough time to then try and start finding stuff. I keep asking for clarification. Where's the fraud? Like, what are your concerns? And they tell me it's proprietary information. They won't tell me what they're looking at. There's like extrapolation that they'll put into there. So if they find 5 claims out of all of these they don't like, they will multiply that by the number of claims they've paid us on during my entire contract with them, which is 6 years. So I have a colleague that now owes over $500,000 because of these things that they're doing. I mean, they're hitting us with some big numbers. And so I'm waiting to see what my number is.
Told people the truth about what they're doing.
To me, that's why I feel like I got it. There's a few of us now that have gotten hit with it. A lot of people now are definitely not wanting to speak up because they saw how my stuff has played out. Yeah. Totally. But if anything, it's made me more ready to fight on it and really ready to push changes, because I worry about what the future of mental health care is going to be in general. And I feel like this is them trying to continue to push us that own private practices and aren't willing to buy into how they want it done. I feel like they're trying to get rid of us. I do.
It's how everything's been going in this country the last couple of years. They're turning the screws until they break off, man. Like
it's a money
thing.
To
just get rid of us.
Yep, it's money. And if you're not willing to do what they want, which is reduce that quality of care, then they don't want us. I truly feel like insurance companies want people to stay sick whether it's mentally, physically, all of that. We push medications too much instead of true ways of helping people heal, because the more that you're sick, the more that they can make off of you versus if you actually get better.
Yeah. And it's like they're in their end game. They know that it's collapsing and they're trying to get all the money they can before it all falls in on
Well,
them.
and people are just
End stage capitalism is a term I've been using lately.
Yeah.
Everybody keeps calling it late stage. We are now in end stage capitalism, everybody.
And people are fed up, right? Like we are using our voice, even, patients, like how many of these, truthfully, like these TikTok profiles, there's the social worker guy that I follow, and people are just fed up. We're sick and tired of being not taken care of and paying for something that really doesn't serve us, right? This whole concept of insurance companies being for profit and having shareholders. And by the way, I've worked for them. Okay. I have. That's in my past. But and so we're tired of it. So given all this in the audit, so what happened next? Like what came next after that?
So that's when I ended up going on TikTok. I was not one that really cared much for TikTok. I really don't like being out there on videos. I don't like public speaking, and I just keep pushing past it all the time now. But I figured TikTok was going to be the best way to kind of get the information out there to random people. That's how I've been able to connect with people like you and whatnot. Yeah. So I've been doing more podcasts. I started to make connections with coalition groups, things that are across the nation. I never got taught any of this. I never got taught how to run a business. I never got taught how to do any of these things. So a lot of Google research has been happening. And so I've tried to reach out to local representatives, and I kind of get the door shut on my face, or they don't want to hear it, or it's an election year and it's not one that they want to really try and push on. There's a lot going on in the world, understandably, but I got to the point where I felt like state level wasn't enough. And so now I'm at the point that I'm just trying to push for federal. So I've taught myself, whether it's good or not, I don't know yet, but I've written an entire bill for Congress that now I'm just trying to get my front feet into Congress to sit there and share it with them about what needs to change. And it's both on the provider side, but also on the client side. I think we need better ways of managing it and oversight on both aspects, not just one or the other, because both sides are getting impacted pretty significantly. So I'm going around and talking about it wherever I can. I've already put myself out there. So, I mean, there's not much I can lose at this point. I'll always stay ethical and legally within my rights. And so there's nothing they can take from that from me. And it's really just making sure people are aware until I can get in Congress and try and actually get those laws to change.
I'm curious with Blue Cross Blue Shield. So because the issue is just with them, correct? You have other contracts with other health plans, I'm assuming.
I have other contracts. I mean, they're not the most ideal. I have other issues with some of them, but definitely not to the extent that Blue Cross is cutting access to so many people here in Arizona right now. Yeah.
And obviously you're focused in Arizona, but Blue Cross Blue Shield has health plans in, many states, right? And they're operated separately. It's like kind of like franchises. I know this because I've worked in this industry for so long. So
like with Medicaid, it's different state to state kind of thing.
Well, yeah, I mean, there's Medicaid, there's Medicare, there's employer plans, there's ACA plans, whatever it is, state to state. But are you aware if they're doing this in all of the other Blues plans and all the other markets that they're in?
Some of those states, they didn't even allow licensed associates to see clients at all and be able to bill under their supervisor. So I've actually gotten more backlash from other clinicians around the country than I have regular members, because they're like, be grateful you can do it in any extent. And I said, well, that's not really where we're at. We should all be working to make it accessible for everybody. It sucks that you can't do this, but I'm not going to settle just because I get the bare minimum. So there's changes that are happening, whether it's Blue Cross. There was a state with CareSource that drastically just impacted another state. So it's not just Blue Cross. It's not just Arizona. Things are happening across the nation that they are trying to go more to their internal networks, their internal servers, things like BetterHelp, Headway, Alma, Rolo, Rulu, whatever that one is. They're trying to get people to go there and essentially get us kind of pushed out or get us to buy into what they want. So it's happening. It's just in different levels, depending where you're at.
And they're starting to purge the rolls too, right? Like just taking people off their insurance, like by the hundreds of thousands.
Yep.
Yeah.
We got reductions in pay recently. So like there's no
reimbursement rates.
Yep. There's no reimbursement requirements out there by law. Insurance can pay us whatever. no matter how much training we have, no matter what inflation is, we don't get increases. Like there's nothing to protect us as providers. Most of us take a loss taking insurance, but we know people need it. And so they're trying to reduce our pay. There's a lot of audits going out. Blue Cross currently just had a settlement. So they're paying out over $2 billion, I think it was. Coincidentally, all these audits are starting to happen. So am I essentially helping to pay a settlement with my audit money? You know, all of these questions are getting raised because of the timing of when things are happening across the board.
And can you explain to, for anyone that, and truthfully, I'm one of them, why is this important that the care, in your perspective, is delivered in the way that they are trying to stop, right? With the supervise, I think you said it was, I'm not even gonna say it. You say it. I don't want to mess it up.
You're good. So every state has a little bit different on how they title people. So I'm going to really speak on kind of a generalized basic, especially here for Arizona. So you have your interns. Those are the ones that are currently in their master's program. So they're under supervision. Part of their requirements is they have to complete intakes. They have to do treatment planning. They have to learn diagnosing. Like that's how they learn to be in our field. They can't bill insurance. So most places will give really reduced rates for interns because they're still in school learning. Once they graduate, they can go and apply for a licensed associate level, whether they're social worker, counselor. That's through the licensing board. They have to take a test. They have to have all of their schooling checked. Like there's still a rigorous process after having completed usually 900 hours of direct client care through their internship. Once they're a licensed associate, then they have usually between 1,600 and 2,200 hours, depending on the state they're in, of continued supervision. But essentially they're licensed. So they're able to go and see clients. They're able to do all of that. And us as supervisors oversee it. We staff it with them. We have regular supervision meetings. We sign off on their notes. But they are the ones that are doing that client contact. They're the ones working with them. For example, my practice, I have 3 locations. I have 16 clinicians. We hit every aspect of age ranges and specialties. We are like a one-stop shop. So I have a clinician that will work with couples, one that works with children, one that works with male issues, you know, whatever the issue may be, we can kind of do it all here. I am not a specialized person in all of those, but I know enough to supervise in that. And we have varying levels of supervision. So that's how we make sure that they're getting what they want. Once they've hit that minimum 2 years, at least 1,600 hours of supervision, then they can apply for an independent license and they can open up their own practice, all of that. Here in Arizona, licensed associates can actually own their own private practice as long as they are supervised by an independent license. Insurance will not let them bill that way, but Arizona, our regulatory board, does think that they're qualified to do that. So insurance, right now in Arizona, only Blue Cross and Aetna was allowing licensed associates to see clients and bill under us as supervisors. United used to. They took that away a few years ago. We didn't notice it much because United's not as heavily used here. Blue Cross is the #1 insurance company here in Arizona. Aetna came off of the marketplace in December. So most people left Aetna and switched to Blue Cross. And then this change comes out. And now they're getting impacted because they can't see our licensed associates. I now have to sit there as the supervisor and do the intake. So we work with a lot of trauma clients. Sometimes getting them in the door is just its own kind of, you know, Olympic sport to get them comfortable to come in. So now insurance wants them to come see me, them to open up to everything they're going through, start to build that rapport. And then I go, hey, cool, thank you. I'm going to now send you to whoever your clinician's going to be. I tried that. I was willing to do it because I didn't want to take away Blue Cross. But the day I had somebody come in and they opened up and they poured their heart out to me, there is no way to transfer that communication to somebody else. I can tell them what I was told, but that vibe, that feeling, that energy, you just can't pass that on to somebody else. Insurance will not let us let the licensed associate do the intake with us in the room watching. So then I go, okay. So then they complete their 1,600 hours in their 2 years and they're now an independent clinician. How do they know how to do an intake if they haven't been allowed to do it for 2 years? They won't even let them do it with me watching. So we're going to end up with less qualified independent clinicians because they're not allowed to do what they're supposed to do through that process while they're heavily supervised. Add in, they're not all my specialties. I am not everybody's cup of tea. We all have our own personalities. So we try and match our clients with truly the right clinician. Well, now I'm always going to be the one they have to see, and I may not be the right one that they may not want to come back just because my style didn't align with them. So we were seeing a whole lot of stuff that was just not lining up with how we wanted to provide quality care, that we had to make the decision that my licensed associates won't take anymore Blue Cross clients that are new. And that was probably a good 70% of our caseload is Blue Cross.
Wow.
And more, there's only 4 of us on my staff that are independent. We are a training site. We are trying to bring the next group in. And so it's definitely been
Which we
a
need.
hit.
We need
Mhm.
we need
Yep.
them. We all know this. This is not a secret, right? Like we need
Yep.
more.
So I have my
licensed
associates,
counselors.
they'll come crying because they don't know what their field's going to look like. They're like, how do I truly prepare to be independent? Insurance does not reimburse me well enough for all of my years of experience and expertise, but I'll still take it just so my associates can use it. And now they can't even bill to it for anybody new unless I jump through those hoops.
It sounds to me like the insurance companies are trying to shut down your whole industry is what it sounds like to me. They're not letting you train new people to do the job, like literally not allowing people to learn how the job gets done. They don't want anyone else to do it. That's I mean, what other motivation is there?
Well, and my thought too is, why does insurance get to regulate who's qualified? If we have a licensing board that gives us our license and they're the one monitoring our continuing education, they're the one making sure that we don't have board complaints, like they're the ones handling our actual expertise. Why does insurance get to then come in and say that they're not qualified? To me, that's where I have my biggest issue, is just that oversight that they're dictating when they have no background in this field whatsoever.
Yeah.
Because once again, it's just money to them. They don't care about qualifications. They care that it's costing them money.
Yeah. They need to stay in their lane, basically. Like really, like they shouldn't be dictating how care is delivered in an inpatient setting.
Exactly.
That's crazy. Okay. I'm so glad that you explained this because I wasn't entirely quite clear. So what does that mean for you in terms of this bill and policy and legislation? And because I really want to, I want to tie it into kind of the focus of this conversation, which is it really does matter who you vote for, right? And you're talking about going federal. So that really this should affect everybody. I don't care if you're in Arizona or Alabama, you should be listening to this conversation if you want to get really good mental health care, right? And how many of us need it? A lot, right? So how does that show up for the bill and going to this like kind of federal level, getting support from people running for office? Like how does...
Honestly, right now, I'm still really kind of boots on the ground. I'm trying to connect with those that have seats at the table that will listen to it. I've tried on a few occasions and kind of just get the runaround or, they'll listen and then there's no ever follow up. So right now it's trying to connect with people that have those people in those areas that are willing to listen, trying to get meetings going with people. I am sending off what I do almost weekly to try and, honestly just bombard them to where they're like, fine, we'll hear you out if you'll just stop emailing us. Like I'm literally at that point that I just don't care. I think more of the general public needs to be pushing back to the insurance companies. They're the ones that pay. So they're going to always listen to that money piece. And so if members or communities are asking questions, they're pushing back to their insurance companies, their employers going, hey, why did you select this insurance if it's not covering what we need? Most of us in this healthcare industry don't even have our own healthcare insurance at this point. We can't even afford what it is for what limited options it gives. I had to take it away from my family because I just couldn't afford it. And cash pay was cheaper for me to do it that way than it is to have an insurance policy as a self-employed business owner. So we need the average people to not just listen, share things, ask questions, make it known, call Blue Cross, email them, tag them and stuff. The more we put the heat on them, the more they're going to have to at least start to look into it. Tag those that are in politics within your areas. It's really just, I'm learning how to do this as I go. Grad school definitely didn't have this whole class on how to change laws. And, my master's program just taught me the basics of counseling. And so I'm trying to figure it out as I go and just really pushing for the awareness piece right now.
So the bill that you wrote, what would that do? What would that change if it, I guess, gets passed or whatever the process is to get a bill adopted?
Yep. So this one, like I said, kind of covers both sides. So it covers the members and it also covers us as providers. We have no regulations right now of how we're reimbursed. So insurance companies can literally just pick and choose what our reimbursement rates are, which is honestly so incredibly low and insulting for some of them. We get paid less for couples therapy than we do for individual therapy. And that's if they'll even cover it. A lot of times they'll tell you couples therapy doesn't qualify because it's not a real mental health issue. And I said, well, if you're fighting in your marriage and then a divorce happens, you're almost guaranteed to have somebody that then comes in with depression, anxiety, all of that. So again, let's be proactive versus reactive. But insurance companies don't want that. They don't want maintenance sessions. They always want to have a heavy diagnosis. So the reimbursement rates is one of the biggest things that we're pushing on, as well as some audit protection to where they really have to be transparent with what they're auditing versus just, we want to send you an audit and we don't have to tell you what it's for, but we say that it falls within our requirements. So they can come and audit us and take our money when the service has been provided. Sometimes that audit piece is because we forgot to check a box, or we put that it was virtual versus in person. And so they go, well, you said it was in the wrong place, so now you have to pay us back for that session. The session happened. We gave the client the services. We mischecked a box, and they're coming back and taking that money. So that's some of the biggest sides of the bill on the provider side. The other piece is the ability for the regulatory boards to actually have a say in who's qualified, not insurance companies. They have to then follow what each state's regulatory board is. Ideally, I would love a national regulatory board versus state by state. COVID really showed that there's a need for that. We have college students that will go home during the summers, and unless you're licensed in that state, you can no longer see them. So there's a disruption of care. So I feel like we really need to tighten that up so there's that continuity of care no matter what you're getting services in. And then for the members, it's being more aware of your services, not going to a value-based care, giving them more options that you don't have to have this heavy diagnosis that follows you for everywhere to get things to happen. So it's really a full circle bill that hits on a lot of things that's just trying to improve the quality and longevity of mental health care in our field.
All right.
Wow.
What's the bill called? Does it have a title?
I do. And we'll see how many times I change it between now and then, because that's how I am and nobody's seen it yet. So I just kind of have it. But right now it's called the Mental Health Access, Transparency, and Accountability Act.
Okay.
So it's really to help hold insurance companies accountable is kind of the biggest thing that I want, instead of them getting to do whatever they want while all of us little people are just trying to actually help people, and we're constantly fearful of our own livelihoods.
Because if we have the name, we can flood Mark Kelly and Ruben Gallegos emails about, you have to talk to this woman about this bill.
Yes. Yes.
Which it would really be the next step. Everyone has, you're in Arizona, we're in Arizona. Most of our listeners are in Arizona these days.
Yes.
Or at least the majority.
We got a
of them.
good percentage of listeners
About,
in AZ.
about half of them on the overall, I think, are in Arizona.
Mm-hmm.
So if we all start emailing Mark Kelly and Ruben Gallego and telling them to look at this bill and support this bill, and we want this bill.
Yeah.
Yes.
That would be.
Or even just a meeting. I'm totally open. I don't know how to write bills. This was kind of me putting my thoughts to paper, but I really want to get in front of them and get them to understand what the average person is experiencing, both from the client side and the provider side, because I'm not certain there's going to be a really quality mental health arena in the next 5 to 10 years. I don't know. My son's 4. I don't know what's going to be coming in the future. And the way the world is, that makes me even more scared that we're losing services, not getting better. We have the most options now for quality everything, technology, inventions. Like, so many things are out there, but as a society, we're getting more and more sick. And that just doesn't make sense to me.
They've been disassembling the mental health industry since Reagan.
Yep.
Like, it's literally been almost 50 years they've been systematically deconstructing the mental health industry in this country.
And all anyone talks about these days is we're having a mental health crisis in this country
because we don't have a system to take care of it.
Well, and we don't
we
have
used to. We used to have it.
We don't have a system, and then we've got more and more people that are raising their hand and saying, "Yeah, I do want help," which is great, but then you can't get in to see anybody. And you had mentioned some of these companies like Headway, oh gosh, BetterHelp, Alma. And so these are big for anyone who's not familiar with IAM. As soon as you rattled them off, I was like, oh yeah, I know all these companies. They're essentially mental health tech companies, right? So they're delivering mental health care which is great, right? Like, that improves access, that sort of thing, which is great. But then they're very, I think the way that they've actually grown and scaled is that they become most often offered through employer plans. Which is where I would say probably the majority of America, outside of Medicaid and Medicare, right? The majority of America gets their health insurance through their employer. And so you get these kind of supplemental kind of like value add programs, and they're like, hey, here's mental health, or Spring Health, I think, is another one.
Talkspace is another one too.
Yeah, exactly. Yeah, I actually know people that work at like all those companies. And so it's great, right? Like, we're creating virtual mental health, et cetera. But then I think they're being, and correct me if I'm wrong here, you probably know, I'm guessing that they're being heavily dictated by the insurance companies even before like a client even walks in the door. So even differently than like how you're an independent, right? Like
Oh,
you have a lot
absolutely.
more
Yes.
autonomy, quote unquote.
Yes.
Would that be a safe assumption that?
Oh, absolutely. While I love
Okay.
the idea that they're trying to use these platforms for, I think the backside of it is not with the best intentions.
Okay.
Talkspace, I saw that they have an issue going on where an employer was paying for it. Talkspace is a lot of texting for your services versus actually talking to somebody. And the employer was able to pull up a bunch of the entire text history and use it in a court case against the person. That's a HIPAA compliant thing.
Oh, yeah, it
BetterHelp,
is.
other places have had a bunch of lawsuits that come through about their information being leaked. They're tech companies. They are not healthcare providers. They are tech. They are about the money. They're literally following, the more I've read into it, they're following the examples of how Uber had started. So they're taking a lot of clinicians, offering them this great pay. Insurance companies will give higher reimbursement rate to these companies than they will to practices like mine. So my employees get to where like, I got to pay the bills. So they'll go to these companies, but then they're actually making less. They have so much more oversight. They're doing things that are some ethical concerns. And then there's struggles to get out of these systems when the clinicians realize what's going on. So the lawsuits are coming out left and right. It is not about truly keeping clients happy, healthy, and secure and safe. It's just about getting money. And because of the ease of access or the cheaper option that's out there, people are going to it. And I understand why, but they're not understanding how that can impact them on the long-term side, which we're starting to see happen more. We're also seeing a push for value-based care. So they want to take a diagnosis and give you a set number of sessions. And if you're not healed by that time, they're just not going to pay your provider. I do a lot with complex PTSD. There is no way to sit there and be like, yeah, 12 sessions, you're going to be good to go. I work with first responders and vets. Sometimes it takes them 4 sessions just to even come in my office and talk to me about more than the weather. Well, there goes, half of my sessions that I can do. And then I'm going to start working for free because insurance thinks, well, you don't actually know what you're doing, so we're not going to pay you. So we're seeing that these big companies, while I like the idea, they are absolutely not there for the clients and their long-term benefits. They're there for their own personal pocket gain.
Yeah. In practice, it doesn't really work the way it should.
They want to treat mental health like a broken bone.
They do.
Yeah,
and they want to just keep the money flowing in. And then too, here, like I said, I've got 3 locations. We've got like 16 clinicians. You can go on my website and you can read a bio and you can start to feel a connection with who you're going to work with to build that connection piece. These companies, you just get assigned. You don't get to pick. And then if there's a turnover rate, so then you may start to open up and then that clinician just decides to go away and you may not ever know where they go because that company, BetterHelp, whatever, wants to keep you internal. So they're not going to tell you where that clinician went. So then you have to restart with the next one and then the next one. And that's where we'll see clients just start to fall off because why am I going to tell my story for the 7th time when they're not listening?
And the other thing too that I've been thinking about, because this is the way of the world, is that a lot of these large insurance companies, what they're doing, like United has Optum, that's their innovation arm, right? What they're doing is they're picking up these startup and these tech companies and they're pulling them under. I mean, there was, I think, there was some video from, I believe it was one of the many things that is on TV, and I believe it was AOC, like grilling like the CVS people and all of those, and they're like, do you know what I'm talking about?
Oh,
and they own everything, right? They own the PBM, they own every touch point in healthcare, and they're creating these like huge conglomerates, right?
It's a monopoly, like everything else in America.
Monopoly. And she was like, so since you control every single touch point for that person, you're like dictating how their care is. And she was calling them out on some of the failures of that with that system. Of course, the talking point from them is that we're taking better care of them because they're inside of our ecosystem, blah, blah, blah. And by the way, I know these words because I wrote them at one point when I worked at some of these previous companies. Like, it was literally my job. So like, I get it. Like, it's not good, right? Like, everybody wants United to fail at this point. I think that CEO that got shot on the street in New York City was kind of like a trigger point, no pun intended.
Some people, when they see the name of our podcast, they go, "Oh, like Luigi." I'm like,
the number of people I've had comments on some of my TikToks, they're like, "Do we need another Luigi?" And I'm like, "That's not going to solve anything."
That doesn't.
But I kind of chuckle at that's the term that people just use of like, we need to take down the insurance companies. And I'm going to throw it out there. If anybody has a connection to Rep AOC, like I would love an opportunity. She's probably the one that is the most vocal at trying to really get these changes. And at the federal level, I've tried every which way to try and get in contact with her because I'm not in New York. It's just like doors shut, shut, shut. But I feel like she's really pushing to try and blow up that entire space of what's happening behind the scenes to let people know that it's just about your dollar. It is not about helping you get better. They just want your money from every aspect, which is prices are going up. If it's all internal, there is no reason prices should go up. You should have all of the ability to bring prices down.
Okay.
Even the insurance companies are now replacing their own agents with AI that will be more likely to refuse people and not be emotional about it. That's why they're using AI now, because the people, even the people working for them, it's getting so bad that they're like, are we never going to cover anything for any of these people that give you all their money? The AI doesn't talk back. The AI just says no.
And it makes you go through stuff quicker. Way. You can audit with AI. They're using AI to now audit. So there's nothing to really look at. So we're seeing it across the board that they're trying to minimize. After my second news interview, I actually had several people that used to work for Blue Cross had reached out and started sharing some information of what was happening on the internal sides. And so people want the information out there that's just that terrified of retaliation from every aspect. But it's not pretty. Blue Cross here is a nonprofit. You're a nonprofit, and yet you can't pay your people actually working a livable wage while they're making millions and millions at the top, probably not even using the same crap healthcare plans that they're giving out to the average person.
They're registered as a nonprofit?
Yes. Blue Cross in Arizona is a nonprofit. And the head CEO averages at least $4 million a year.
Yeah, I don't see how that.
And I, as the actual provider, can't even afford health insurance for my family because of the cost.
Doesn't make sense.
Right.
The other thing I want to ask you too, and I think I know the answer to this, are the majority of mental health counselors, licensed clinical professionals, et cetera, the LPCW, I think I don't know if I'm getting that acronym.
There's a whole alphabet soup. You're good.
All of the things. Are they typically independent? Like the majority of counselors? Do you have any? I'm just curious.
You mean like where they work?
Yeah, like either working for themselves or somebody like you versus like a Headway or a large practice or something like that.
A lot of them will end in community mental health care. That's where they'll kind of go right after internship. Oftentimes the burnout and turnover there is just astronomical. I loved the work there, but that burnout was just something else.
Like at a FQHC type of thing?
Everywhere. You've got specialized ones, you've got kiddo, all of it. It's just they work you to the bone. At no fault of their own. It's just the need that's out there. And a lot of people don't want to do it because you don't make much money doing it because, again, reimbursement is horrible. But then when you start looking at it, I think when the Headway came over, we're seeing a bigger shift for people to go to places like Headway because they will pay you more. But prior to that, most people ended up in a private practice setting or community mental health. And it was one of those two spaces, or a lot of social workers would end up in hospital settings and doing that. Most of them, though, will end up wanting to work for a practice. And it's usually finding somewhere local or somewhere that aligns with what you want. I've been grateful to have interns now come and intern with us after seeing my news interviews, and they want to kind of join in on the advocacy. So they're coming to us for the internship. So I always phrase it as therapy is like dating. Finding where you should work is like dating. You got to kind of try it out and see what works best for how you are as a person. But we're seeing a bigger shift of them going to Headway because of the financial ability. And then they're regretting it and trying to leave. And it's not easy to leave that world. And so there's a lot of questions on how that's happening for them as well.
Gotcha. Okay. Yeah, I kind of assumed that was the case. So with, mental health, it's like mental health has become almost like a buzzword, it seems like, which it's good and bad, right? It's good we're talking about at the same time. Sometimes I feel like it takes away from the kind of deeper conversations around it, right? Like that some of that like legitimacy around the real hard work that happens when you're going through mental health therapy, whatever level it is, right? Like some people need it a couple of times, some people need to go for the rest of their lives, right? But if insurance companies are dictating how that looks, right? Like how that plays out in your office. And there's really nothing in place today legally, right? Like there isn't the intention of this bill. what is your expectation? Let's just say hypothetical, right? Like if the
Mhm.
world was working the way it should, is that this bill would then basically force the insurance companies to allow basically the right things to happen, correct?
Mhm.
Like kind of, and that's what would happen. And then we would all of a sudden they would be, their hands would be forced. They
Mhm.
would have to align to that bill or be held accountable for whatever
Mhm.
those consequences would be. So if it was to work that, I'm going to like ideal state here. So like if it was
Perfect.
to work that way, right? And that's how it should be. And by the way,
Mhm.
like there's a lot of things wrong with the healthcare system. We know this. I actually put a
Mhm.
post up on TikTok and Instagram the other day asking what, kind of bothers you the most. I've had so much engagement on it, and it's so
Mhm.
much about these very, very things that you're talking about, whether it's physical health or mental health.
Mhm.
So if things were to work that way, the bill was in place, it was supported, we were all working in that world, what would care look like? Like what would be like this idealistic state that's not even idealistic, it's right.
Mhm.
How would that look for people? How would people experience
Honestly, they would have
this?
lowered healthcare premiums so they could
Mhm.
actually afford to have healthcare without astronomical deductibles that they're paying, $1,000 a month for their premium. And then they have to pay $150 a session until they meet their $15,000 deductible that they may never end up meeting. So right there,
Right.
that's already cutting access to care for so many people. So that's going to be reduced to where maybe you have just a flat $20 copay. Mental health is deemed differently for a lot of insurance plans too. So you may have only a $20 copay for healthcare, for physical, but then you're going to pay a deductible for mental health because that seems to be a luxury thing when you look at insurance plans. So they have that. You're going to have more options out there because there's going to be quality care that's out there. You're going to be able to call, you're going to be able to get in with somebody that actually matches with that. You're going to be able to see them without a fear of a diagnosis because, well, if you have certain diagnoses, you may not get life insurance policies. It may impact your job. It may impact other future things because they'll use that against you. So then again, there's that stigma. So we're going to be able to diagnose without it being a label, or honestly, just let us as the professionals be able to provide care. I have a lot that like maintenance care. They want to come in once a month because it gives them a chance to just kind of dump whatever's gone on so they don't go back down that line of having long-term issues. Insurance doesn't like that. They said, well, they don't really need the services. So people that just want to come in and have a space once a month to prevent issues would be allowed to do it instead of only being reactive. We wouldn't be fighting to get insurance to pay us our claims. We wouldn't be fighting when insurance pays us. Aetna took over $10,000 out of my account and then admitted it was wrong. And then I'm still fighting now, almost a year later, to get it put back into my account for
Oh my God.
services that were provided because they made a mistake. So I spend more time than what I've actually earned just trying to get the money that's owed for the services we've provided. Or you have to fight on the denials because insurance doesn't agree with it. All of that would go away. That my burnout does not come from clients. My burnout comes from dealing with insurance and trying to just make sure people have the ability to get care. All of that energy, if I could put it back into my client sessions, the
Mm.
impact that would have for the quality and there's no resentment then. I don't have to hate taking insurance because I know it's going to be a fight every time. So all around, our clients and providers are going to just do better, and providers are going to have less burnout. So you're going to see them actually just giving better care to their clients as well.
Yeah,
And
that's
you'll probably see more people in the field because if it's
Mhm.
a better place to work and you actually get to do what you're there to do,
mhm.
and you're going
Exactly.
to get compensated appropriately for it without all the trouble, you're going to
Mhm.
have a lot more people who are going to actually want to do that job.
Yeah,
Mhm.
I was going to say operating at the top of your license, right? I mean, I think
Yeah.
that's really the end goal. And unfortunately, because of the administrative burden that you're faced with, you spend way more time and
Mhm.
dedicate way too much, probably salary, right, for people that work for you to deal with all of these friggin', obstacles and hoops and all
Mhm.
the things. Well, meanwhile, wouldn't it be great if you were just spending that time supporting your clients and your
Right?
patients, like
Right?
making
I
a
would
better
love
world?
that.
Yeah.
I would love it. And then there's a guarantee that there's going to be a future in this field and we can actually properly
Yeah.
train and really bring them in. For whatever reason, mental health people, not people, but people think those of us in mental health care should always struggle. I have a graduate degree. I have ongoing
Mm-mm.
training that I couldn't even tell you the number of thousands and thousands I've spent on training to provide better care to my clients, but we're not reimbursed. We're not
Mhm.
deemed appropriate to pay adequately because it's just mental health care. our requirements are so high level and fiscally just astronomical, but we're told, oh, well, yeah, just don't expect to make money in this field. And I don't agree with that either. You know, you can go to a plastic surgeon and they can roll around in these expensive cars and they're just expected to get paid for that. We're saving lives sometimes and really helping make sure that the next generation is okay. But we're just supposed to sit back and take, you know, pennies on the dollar for what we do. And that needs to change too.
And that's part of this kind of, you know, provider and nurse shortage as well. One, the cost of going to school has become so untouchable for so many. And then second, because of everything that you're talking about, right? And things that come up on this show and many episodes, nobody wants to work in that environment. So why are they going to go down that path? And now we don't have enough, you know, licensed clinicians in all the fields to take care of.
Yeah, it's not even just mental health, is it?
It's everything.
The same thing is all through healthcare.
We're imploding on ourselves as a country, honestly, in that respect.
I'm going to say it again. End stage capitalism.
Yeah. Like,
this is
well, if you look at COVID,
like when the system starts falling in on itself.
Yeah.
Healthcare, mental health, everybody during COVID was like, yes, these are the people that are going to save it and blah, blah, blah. And now here we are 6 years later. And it's like, we're the bottom of the barrel and we're the first that are going to get dismissed because, well, we have AI and you tell people to go on to ChatGPT. Yet we've already got cases where ChatGPT has basically confirmed that people should kill themselves and they follow through with it because it's not a human. ChatGPT or any AI could be a slight substitute when used in right ways. But if you tell it you're sad or you tell it you're the best person on the planet, it's usually going to tell you what you want to hear. So where are you actually getting the care? You know, if you want to pump yourself up, talk to AI. It'll tell you everything you want to hear.
AI does not think, it is not conscious, and it has no emotion. It's literally going to, the large language model sees what you said and it tries to figure out what you want it to say.
Right.
Yep. It's a people pleaser.
So if you ask it a question, hey, should I kill myself? It's going to go, yeah, sure. That's a great idea. Because it thinks
if that's what you
need
to do to feel better, that sounds like a great option.
Because it doesn't even understand the question.
It
literally doesn't understand the concept of death.
Yeah.
And what life is and what it means to live and die. It has no idea what any of that means.
Yep.
Like, stop talking to AI like it's a person.
Stop talking to AI. Don't name your AI. Shoot, I named my ChatGPT Eleanor last year.
Yeah, like don't do that. They're trying to get you to do that because they want you.
But I use it for editing copy. Just FYI, I use it for the reasons that's okay.
Take this 1,000 words and make it 700 for me. Like, that's what AI is for.
Well, and a lot of these platforms are using AI to then listen in on the sessions, and they'll tell you, oh, it's not going to go anywhere. And I mean, call me a conspiracy theorist, whatever you want to do. I don't trust it. I truly feel like they're wanting to use AI to continue to build it up so they can push us as real clinicians out, because then they don't have to pay us at all. And so we don't use AI here at my practice at all. It's my clinicians know how to do their notes. They are not that in depth that you can't do it at this time because it is about the client's privacy. And so I don't trust those big platforms with all the AI components that they're adding in.
And I mean, people want people, right? Like we want to interact with other humans when we're coming to see a clinic. I mean, I don't know anybody who doesn't. I can't imagine. And it's like to remove that.
Yeah, robot doctors is not an option.
No, we don't want that. And
not an option.
Especially with with mental health, right? Like we need another human who is going to look at us and see us and hear us and talk us through whatever issues that we're going through. I just can imagine not having that option, you know?
I am fully convinced that the top 1% really just want the rest of us to die, but they have to replace us with robots first so they don't have to do things for themselves.
It's like iRobot.
Like, I really think that's like what's in their mind is they would rather us all just not exist.
That's sad. That makes me sad.
That's what that kind of money does to a human, though.
True.
The money becomes more important than humanity.
Yeah, there's some good movies out there that kind of cover that topic, and exactly that. They're like, I'd rather have a robot than a human, and then at the end they regret it. But you know,
I don't want robots on this planet unless it's the Jetson style made one that'll just come and like clean my house.
She'd be great.
It's super sweet and isn't out to take the world. But every time I think of it, I think of iRobot, and I'm like, we see how these things end, and it's not going to end well. And when people are leaving these robotic and AI companies because they're like things are out of control, that's worrisome. When you have people that create social media and don't let their kids on it, that's worrisome. When you have people creating these talk spaces and healthcare programs, but then they don't want their family members using it, we need to pay attention to that, because if you create it and you don't want to use it yourself, what is that really happening behind the doors?
Yeah.
Right.
Yeah. All the guys who own the cell phone, the really rich guys who own the cell phone companies, their kids don't have cell phones. Think about that.
Yeah.
Yep.
Bill Gates's kids didn't have smartphones, dude.
I will say though, at the same time, there's some really, because we bring these people on the show, there's also some really good work being done in the tech space that is supported by AI for health, for the purposes of
Well, it's
healthcare.
a tool. You got to use it right.
It's
If
using
you're using it to collect and
that is not
data
okay.
and calculate data and things like
Right.
that. That's what it's for. It's
Yes.
not for making friends and giving you life advice
No, we don't want any of
and
that.
like actually like deciding what
Right.
treatments people should get in real life, because it doesn't understand those things.
So
If you want to calculate some odds, AI is great.
sure, it's good for that.
It's good for math. It does math well.
So I want to put a bow on this conversation.
I am getting a little heated. I'm going to go off the rails here.
Yeah, I'm sorry. It's just dorking out by saying that. But, I really do. So the bill is really important. It's not accessible anywhere publicly online, correct? Like it's just kind of your own private document. So I want to leave people with some action items. So what do you need and what should we be doing as, patients, consumers, members of our community in order to help further potentially your bill along? What do you need from the people that might be listening right now that would help you? And then what can we do? What should we do to advocate for ourselves?
I think
our
kind of goes
states and
hand in
communities.
hand on both of those, because advocating for yourselves and advocating for the big kind of bill essentially goes hand in hand. They're going to work together. Again, anybody that has connections for me to sit down, I will speak to anybody to really kind of help people understand, to push the information out there. So anybody that wants to connect, work together, has those, like, please send them my way. I will do whatever's needed. Helping push the awareness piece. If you're using an employer funded one, talk to your employers. If it doesn't cover the right stuff, we have to start pulling from giving them our money. Too many people go, well, if I don't have health insurance, what about that big crisis? I refuse to live on the off chance that I'm going to get in a massive car accident, because that $1,000 I'm spending a month puts me so tight that I don't enjoy life anymore. So we have to really look at getting a little uncomfortable to make change to where we can be more comfortable. But if we stay complicit and keep just doing what they say, then they're never going to change, because they know that we're going to end up buying in and just doing what they need. So it's pushing against your employers. It's dropping the policies if you can. There's some cost sharing ones that are out there. So it's taking it away from these large corporations. It is going to the insurance companies, sending letters, going very public on social media and calling them out directly, asking them, what are you going to do to manage this? How are you going to fix these things? Calling out Headway, Talkspace, asking them those same things. Because if we get them backed into a corner, they're going to have to maybe relook at it. If they start losing money, they're definitely going to have to reconsider what they're doing, because that's their bottom line. We're not going to win against the insurance companies, though. They have too many lawyers. They have too much money in their pockets. It's going to be pushing for that law change. So when you hear of bills that are happening across the U.S. on state levels, get vocal about them, join those local organizations to help push it forward. The more states that even start getting bills passed, the more we have that collective ability to also bring it to a federal level. But it's about bringing your voice to the table, asking questions. And that's kind of where we're at for the average person to help out with it.
Okay.
How do people find you on the socials?
I'm not a huge social media person. I kind of got to that generation where I don't care for technology. But we're on Facebook, which is where, yeah, I used to be the one that knew it all before my parents. And now I'm that parent that doesn't really know much of it anymore. Again, I don't like being out there much. So this is still out of my comfort zone. But Facebook is where I tend to just keep it the most updated. It's just the easiest. So that's Northern Lights Therapy. We are on Instagram. That's on Northern Lights Therapy AZ. And then I have my own TikTok, which is Inked Therapist 21. And I'll post a lot of more of my rants on there. That's my personal versus the business side of it. So I try to keep that one a little separate. So I'll go on my rants whenever I need to on there.
Cool. All right. Well,
put those in the show notes.
If anybody knows anybody, somebody running in your state.
If anybody has a connection to AOC too, that actually sounds like a great idea.
I feel like she'd be the one that would really help just push it to another level, because she is just not willing to back down.
If you could get Mark Kelly from Arizona and AOC from New York, then you're really talking, because then you have a senator, a representative. You got both houses. If they both sign on to something, that's got a lot of backing.
I've reached out to Kelly a few times, and I get kind of the generic responses back. So I'm hoping that enough reaching out. Again, it's that you're going to get sick of me, and they're just going to want me to shut up and leave me alone. So they'll give me that meeting, and I feel like once I can get there and really sit down and have 30 minutes to just kind of really explain it, I feel like they'll be willing to want to push it forward, because it needs to happen.
You probably got like 4 layers of people you got to work through to actually get to him on that one, because he's been a senator for a while now.
All right, people, this is the homework. If you're listening, you know somebody that knows somebody that knows somebody. Hook it up.
Hook it up.
Yeah, help a sister out.
Get vocal, share things. I mean, whatever's going on, the more awareness that people get, a lot of people just don't know, or they think it's us as providers that are being greedy. It is not us that want to pull from insurance, but we get to a point where it's quality that we don't want to sacrifice the quality of services to stay with insurance. And it's a tough decision, but I promise it is not providers wanting to be greedy and just get all the money.
Yeah. Right. And your vote counts.
Yes.
And
there you go.
Make it count.
Your vote, your health.
Find the people that align with your goals and your values, and vote for them. And then make sure that they call Brianna and help her with her bill and get that pushed through, because I'd like to see that happen.
100%.
Yes, for you and for everybody, right? For our benefits.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors, and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut up!